Good afternoon, everyone. My name is Judith, and I will be presenting our caregiver orientation today. Again, welcome to DJC Rock Home Care. We are happy that you're here, and we're going to go over a few things with you. Okay? And again, if you have any questions, you can please reach out to us or send us a text. Again, welcome to DJC Rock family. Our commitment. So let's go over our commitment. DJC Rock Home Care knows we all age in different ways, with different needs at different times. Many adults with medical conditions, as you all know, disabilities, or changes with aging choose to remain in the comfort of their own home. We make it possible by helping with the task of daily living. Our person-centered care provides the physical, emotional, and spiritual support that everyone deserves. What we offer, we bring peace of mind to the client's family, providing the increased safety, comfort, and independence for the clients. Flexible shifts. Clients have the opportunity to bring help into their homes versus having to move somewhere to get additional help. Non-medical work does not require you to obtain any special certification. We are able to provide most of the accommodations that our clients would receive in an assisted living community in their own home. Job description of a caregiver like you, that listening right now and watching. As a non-medical care provider, we provide in-home support services that focus on non-medical care on an hourly, daily, nightly, weekly, or 24/7 basis. Services can include personal care, housekeeping, errands, respite care, meal preparation, and social contact. The caregiver is to provide assistance as outlined in the client's plan of care. Any deviations or additions to the plan of care must be approved by the office. Services caregivers provide: companionship, personal care, household chores, meal planning, meal preparation, clean kitchen, grocery shopping, and limit, but it has to be approved by the agency. Run errands also has to be approved by the agency. Provide transportation to appointments has to be accommodated by the agency. And we also do Bible study, and it's optional. Organize wardrobe, wash laundry, iron clothes, make a bed, escort on walks, help organize social outings or entertaining, help with pet care if they do have a pet, supervise home maintenance. Companionship. Companionship, let's go over companionship. Provide respectful, friendly interactions, assist with hobbies, crafts, reading or writing activities, special activity to build relationship and make them feel special. Let's talk about meal preparation. Grocery shopping. Be sure the receipt is given to the client or secured at home. Meal planning, try to introduce their favorite foods. Meal preparation, encourage your client to share recipes. Eating meals, offer to sit with client if appropriate. Bring your own meal unless instructed otherwise by client. Encourage eating proper amounts and drinking adequate water. Review client assessment for food allergies. Laundry. Laundry assistance, change bed linens. So that's simple. Light housekeeping, kitchen, wash dishes, load or unload dishwasher, wipe counters, sweep, vacuum, wash floor, clean appliances and refrigerator, bathroom, clean bathtub, sink, toilet, and mirrors, vacuum, wash floors, limited. Living room, dust, sweep, vacuum, floor. It's also limited, and it has to be approved by the agency as well. Bedrooms, make beds, change linens, dust, vacuum, sweep floors, tidy areas. Ask your client about cleaning preferences. And also, when it comes to washing the floors, please talk to the agency to make sure that it is within the scope of care. Personal care includes showering, bathing, assisting with shaving, toileting, shampooing hair, and dressing. Most adults prefer to be as independent as possible. Whenever possible, the client should direct the care. If the client is confused or unable to give directions, the caregiver should guide the client through the routine while always being concerned with the client's safety, privacy, and comfort. Safety. Let's talk about safety under personal care. Safety. Verify that the shower or tub floor has a non-skid surface. Use a rubber mat if possible. Place a bath mat or towel on the floor for the client to step on when coming out of the shower or tub. Have the client use safety bars for assistance if available. Never allow the client to hold onto towel bars to support their weight. Have a client use a tub bench, transfer bench, or shower chair if they have one. Avoid exposing the client. Use towels, a sheet, or a light blanket. Let's talk about privacy. Close the shower curtain and or bathroom door to allow the person to complete as much of the shower as possible. The client may only need help with washing his or her back or other hard-to-reach places. Let's talk about comfort. Test the water temperature. It should be about 96 to 103 degrees. Make sure the room is warm and drop-free. Proceed with confidence. Clients are more comfortable if they feel the aid is experienced. Organize equipment and supplies in advance. Organize supplies such as towels and soap. Place them where they will be easily accessible. Work from cleaner to dirty areas. Do mouth care before bathing. Wash the face and neck before armpits, feet, and bottom. Think about standard precautions. Wear gloves whenever coming in contact with body fluids, such as in the mouth and genitals. Wash hands before and after doing personal care. Universal precautions. Universal precautions are general practices to follow when working directly with any client. All human blood and body fluid should be treated as infectious for hepatitis B, HIV, and other diseases spread by contact with blood and body fluids. It is impossible to know whether these fluids are contaminated. One must always treat them as infectious. Hand washing guidelines. Saying happy birthday 2 times. All home health care personnel will wash their hands before and after contact with the client and whenever hands become sore. Other times, hands should be washed off immediately after coming in contact with blood or body fluids, before and after wearing gloves, before eating, drinking, or handling foods, after using the toilet, blowing the nose, sneezing, or combing hair. Infectious for proper use of gloves. Wash and thoroughly dry hands before putting on gloves. Handle gloves carefully while putting them on. Never use gloves that have been torn or punctures. Change gloves between procedures and after contact with each patient. Wash hands before sets of gloves. Never clean and reuse disposable gloves. To remove gloves, peel them off one at a time, pulling them inside out with the contaminated inside to the inside. Properly dispose of used gloves in the family's trash. Other services: bring in sort mail, answering door, telephone, assist with transfers, ambulation, escort on walks, take out garbage, grocery shopping, transportation, assist with eating. Again, grocery shopping and transportation needs to be approved by the agency. Professional boundaries. Boundaries are limits that allow a client and caregiver to connect safely in a therapeutic relationship based on the client's needs. It is the caregiver's responsibility to maintain appropriate boundaries, independent of the action of the clients. Maintained detached concern, i.e., professional relationship for client rather than a close personal relationship. Be fair and honest when sharing a client's concerns and needs with other team members. Collaborate and share information with other caregivers, family, and in the office. Maintain professional boundaries. Boundaries remain constant no matter how much contact we have with the client or who the client is. We are responsible for setting the boundaries with the client. If we allow the boundaries to be crossed or blurred, we are the ones who are held accountable, not the client. The closer the age, likes, dislikes, etc., the higher the likelihood of crossing or blurring the boundaries. Boundaries detail examples. Do not take gifts or tips from clients. Do not take clients out on your personal time. Do not discuss your personal life and life stresses with clients. Do not give clients your home or cell phone number. Do not discuss finances, either clients or your own. Do not place yourself in the middle of family issues. Do not discuss other clients. Do not offer medical or homeopathic advice. Do not have a romantic or sexual relationship with a client. Do not share your client's personal information. Client Care Service Plan. The Client Care Service Plan handout describes what the client and or their family has asked. It is written such that someone who knew nothing about the client could read and care for the client effectively. Do not perform any tasks that are not detailed in the care plan without discussing it with the office. Due to the nature of the information of this document, its confidentiality is required. Caregiver daily notes, documents that we have been performing as a care plan directed, must be as detailed, professional, and objective as possible. Family members, healthcare professionals, and client themselves will be seeing your notes. This information is confidential and can only be shared with consent. Please do not include the following in the caregiver daily notes. Do not write opinions, express feelings, likes or dislikes. Do not write about scheduling problems. Do not write negative or critical statements about the client. Do not interpret or evaluate any events that occur. Simply write what you saw or heard. Emergency situations. With any health or injury situation to the client, notifying the office immediately. If it is a life-threatening situation or a serious injury has occurred, call 911. Do not move the client. Remember, our service is non-medical. Remain calm and collected and summon help in a medical situation. Protecting the client's personal information includes how to answer the phone, whom to let in the house, how to handle people selling things, etc. Protect your client, banking information, social security number, credit cards, etc. Immediately call the office if you believe any of this information has been exposed improperly, even by the client themselves. Communication with your client. First, impressions set the tone of your relationship. Demonstrated good communication techniques, i.e. active listening, eye contact, etc. When you meet, ask these key questions. What are your special interests? What was your profession prior to retirement? Do you have children? Conversation etiquette. Face the person you are speaking with and maintain eye contact. Bring yourself to their eye level. Never shout unless a person is hard of hearing, ease into the volume. Read reactions and body language. Ask simple questions and give direct answers. Arm or shoulder touch may be a possible gesture if it does not make a person uncomfortable. Talk without distractions. Use Miss, Mrs., or Mr. until invited to use first name. Ask rather than tell. Can, will, and please are essential success word. Why? What to avoid when communicating with your clients. Do not order them around or tell them what they can and cannot do. Don't be condescending. Do not ask a lot of questions that rarely on their memory. Do not talk about the client to anyone in front of them. Instead, include them in the conversation. Managing clients' emotions. Always be aware of your client's emotions. Your client may experience frustration, anger, agitation, and depression. Helping your client manage these emotions is an important part of your job. Physical factors that may drive emotions are side effects of medications, pain, dizziness, weakness, exhaustion, symptoms of illness, flu or cold. Environmental factors can include noise, unfamiliar people, and places. Other situations that can contribute to an emotional response from your client is being asked a lot of questions, family members impatient or inattention, being scolded, contradicted, inability to do normal tasks, changes in routine. Part 2, managing clients' emotions. The caregiver needs to acknowledge the client's feelings, recognize that the client is having these feelings, and empathize with them. Let them know that you understand that they are having these feelings and that you are going to try to help them through it. A very effective method of helping a client manage their emotions is to help them preserve their hobbies, interests, and daily routines. Assist them to do something that they enjoy. Learn about their interests and share that interest with them and try participating with them. Promote exercise of both the body and the mind. Understand what their physical limitations are and encourage as much exercise and their condition will allow. Engage them in conversation that will stimulate their mind. Encourage participation in household activities, craft, or games. What is elder abuse and neglect? Physical abuse, injury, unreasonable confinement, or punishment such as slapping, cutting, and burning. Psychological abuse, threats or physical abuse, verbal, intimidation, or humiliation resulting in mental anguish such as anxiety or depression, isolation, yelling, screaming, demanding language, or insult. Sexual abuse, sexual contact that result from threats, force, or the inability of the person to give consent, including but not limited to assault, rape, and sexual harassment. Financial exploitation resulting in monetary and personal loss. Activity and passive neglect, deliberate or without a conscious deprivation of goods or services. Signs and symptoms of client abuse. Bruises, burns, cuts, or broken bones, repeated injuries. Afraid all of the time or very nervous, depressed, ashamed, or overly embarrassed, lack of medication or medical care, sudden bank account closing or withdrawals, living in poverty with adequate financial resources. What else? Prevention. Caregivers listen to clients and their family members or significant others. Caregivers intervene when abuse is suspected. Caregivers educate people on how to recognize and report abuse in elders, older adults, younger adults, children, and those less able to include animals. If you suspect abuse, report it. DJC Rock Home Care Office staff members should always be notified of any suspected or witnessed abuse, neglect, or exploitation of the clients you are serving. Have you seen it? Caring for clients with memory loss. Dementia is what happens to a person when they have illnesses such as Alzheimer's, vascular dementia, Lewy body dementia, frontal lobe dementia, and Pick's disease. These illnesses cause brain cells to die off far more rapidly than normal. It is a progressive illness for which there is no cure. In the people you care for, you will notice many symptoms, the main on typically being memory loss. Dementia. People with dementia lose the ability to communicate effectively. They can become withdrawn and seem to have no get up and go. They may lack insight to their abilities and believe that they are fine, or believe that they are still able to do most of the things that they could do before having dementia. The person with dementia will have been experiencing difficulties over a period of time. Some of the difficulties may include confusion days of the week, forgetting to show up to appointments, unable to handle money, neglecting personal care, becoming isolated, frightened in their own home, becoming aggressively vulnerable, unable to go out on their own, forgetting the time of day or night. Changes in the behavior. Dementia. Constantly moving around. People with dementia are often unable to sit in a chair all day. They can be very reluctant to settle or sit down. At certain times in the day, they may just want to be on the move. Doing routine exercise or walks will help. If a client begins to wander, walk with them and monitor them so they do not fall or injure themselves. There is often a daily rhythm to Alzheimer's disease. Reasonable competence and cooperation in the morning, then a downhill course until by the evening. The person is confused and irritable. This is sundown syndrome, mental deterioration, and increasing behavior problems as the day wears on. Take time of day into account as you plan activities for the affected client, person. Do things that absolutely must get done early in the day. Dementia. Repetition. Remember that people with dementia cannot remember asking the same question or giving the same answer. If possible, distract them from the topic by giving them something purposeful to do. For example, folding towels or dusting and polishing. Asking for mother can be a common occurrence and usually indicates the feelings of insecurity and fear. Acknowledge the insecurity and try to move off the subject to another activity. Begin an activity that the client is more familiar with and enjoys. Searching hoarding. You may find your client constantly looking for a handbag, wallet, keys, scarf, or other items. Important items can offer great comfort and security. Allow the person to keep their belongings on their person. Hiding things such as glasses, food, or other personal objects could be for any reason. A very common reason for hiding things is that the person has a fear they are going to be stolen or taken. Learn the areas where your client hides things. Compulsive Hoarding is commonly driven by fears of losing important items that your client believes will be needed later. Typical symptoms of Alzheimer's: short-term memory loss, confusion, days of week, time of day, unable to handle money, neglect of person care, challenging behavior, wandering, repetition, searching and hoarding. Sundown syndrome, reasonable competence, incorporation in the morning, then a downhill course until by evening, the person is confused and irritable. Mild stage, forgetfulness, complex tasks are difficult, confusion. Moderate stage, memory loss that interferes with ADL's activities or daily living, decline in personal hygiene, increased wandering. Severe stage, need for extensive assistance, increased irritability, symptoms of psychosis. Okay, let's go over the Alzheimer's Association Cares Dementia Care Approach. C, connect, talk to an area free of distraction. A, assess behavior, always identify yourself and use the client's name. R, respond appropriately. Continue to use eye contact in a sturdy, even tone when speaking. E, evaluate what works. Use simple sentences and ask questions that have yes or no answers. Share with others. Ask rather than tell. Offer simple choices. 6 care practices for person-centered care. 1, ensure nutritional well-being through adequate food and fluid consumption. 2, manage pain to ease distress and avoid unnecessary use of medications. 3, engage clients in activities that have personal meaning. 4, prevent unsafe wandering and promote safe, independent mobility. 5, reduce the risk of falls and fall-related injuries. 6, encourage physical restraint-free care. Emergency situations. In an emergency situation, medical emergencies, call 911. External emergency, any event in which taking shelter is the most prudent action. Internal emergency, any event in which evacuation is the most prudent action. In fire emergency, stop, drop, and roll, know your evacuation plan. Weather emergency, community weather warnings, and knowing when to report to the DJC Rock Home Care Office. Learn where to go, when to go, who to call, what to do, what to take, how to prepare, and how to care. Falls. Let's talk about falls. Reduce the risk of falls. Keep walkings clear. Use night light in hallways, in bathrooms, or poorly lit areas. Encourage appropriate footwear. Do not climb ladder, rugs, or stand on stools higher than 2 feet off the ground. Reacting to a fall. If a client begins to fall, try to resist the impulse to catch and hold the client. Guide the client to the ground. If near a wall, gently push him or her into it. It will slow the fall. Do not help a client to their feet by yourself. You cannot determine whether or not an injury has occurred. Call DJC Rock Home Care office immediately after securing your client. Call 911 before the office if your client experiences an injury or illness that requires medical attention. Remain with your client to provide support while waiting for help to arrive. If falls must be reported to the office. Protect your back and learn to lift. Now on page 35 in the Caregiver Training Guide. Our commitment to our caregivers. Our commitment to our caregivers is to provide a strong foundation of support through community education and appreciation. We value the person we serve and those who serve alongside. You are here because you have that special something that will make a big difference in someone's life. If you ever feel overwhelmed or have questions, we are your partners in caregiving. Come and or call. Communicate is key. At DJC Rock Home Care, we believe caregiving is a gift. When family and friends can't be there,